Live, this is Fox News Midday.
October is Breast Cancer Awareness Month, a time to highlight those impacted by the disease and also inform the community of life-saving information. So why don't we do that right now? We have two very special guests joining us. Martha Gomez-Smith, a two-time breast cancer survivor, and Dr. Jessica Treviño Jones, breast medical oncologist with the Mays Cancer Center at UT Health San Antonio. Thank you so much for coming in, representing in pink. I completely forgot. I apologize.
Okay.
So Martha, tell us a little bit about the time when you first thought, okay, something's off, something's not right, and then the next steps that you took after that.
Sure. I received a letter from my from the imaging center that my annual mammogram came back abnormal, and that I needed to come back and get a ultrasound. And the ultrasound showed that there was that cancer was probable, and that I needed a biopsy to confirm it.
And then you just did exactly that? And
I did exactly that, yes. And after it was confirmed, I started looking for an oncologist. I knew that I needed to go there first and just to see what my treatment plan was going to look like, what my options were.
And a lot of people are in that situation. What message do you have for them, a message of hope and that you can come out of this, because you've beaten it twice? Right.
Going to the Mays Cancer Center was instrumental in my positive outcome. It was a true comprehensive, targeted, I felt that it was a personalized treatment plan. I saw my medical oncologist, Dr. Jones. I see a cardiology oncologist. I've even had conversations with a dietitian, and the nurses at the infusion center are phenomenal.
Aww.
So that gives me hope. I was well informed. They took very, very good care of me.
And let's get well informed ahead of time. So Dr. Jones, let's talk a little bit about some of the common risk factors that everyone should be aware of.
This is an excellent question and something that all women we should be aware of. What increases our risk of breast cancer? Because first and foremost, any woman can get breast cancer just by us being women. But I will say that if we are older, if we have denser breast, if we're not at our ideal weight, these all play into us having a higher risk of breast cancer. And maybe most importantly, if there is a family history of breast cancer, these women, we should be even more diligent to ensure she gets her yearly mammograms.
Yeah, and so the recommendations right now, because sometimes they change, but it's annual mammograms for those 45 to 54, and then women 55 and older every other year. What should women also maybe ask their doctors in regards to the genetic testing?
This is another wonderful question because genetic testing is so underperformed right now. So what I would say is to any woman who has a family history of breast, ovarian, pancreatic, colon, actually so many cancers now we've come to learn are genetically linked, to ask their doctor, where then your doctor could even refer you to a program with what Martha had, which at Mays Cancer Center, we do genetic testing for both cancer and non-cancer patients.
And as a survivor, as an oncologist, what does this Awareness Month mean to y'all?
It has a deep meaning for me. It reminds me of my journey. We need to celebrate those that are here, their survivorship, but also honor the people that have not made it. But it's also a time to have conversation with our families, to talk about family history, right? Because I don't know that those conversations are had often. But this is a time to sort of honor that in the spirit of Breast Cancer Month.
And so everyone can also get more information at cancer.uthsca. Wait, I'm going to say it again. UTHSCSA 450-1000. Thank you so much for coming in today.
Thank you
for having me.